Hello, my name is Julie Tai, and I'm a second year family medicine resident at the McLaren Flint Family Medicine Residency Program. Today, I will be presenting the implementation of my study called the Behaviors and Attitudes About Breastfeeding Study, also known as BABY, in an urban underserved community. It is important to know that exclusive breastfeeding in the first 6 months of life is highly recommended by several health organizations, including the WHO, the CDC, the American Academy of Family Physicians, the American Academy of Pediatrics, and many more. Studies show that breastfed infants have reduced morbidity and mortality compared to those infants who are not breastfed. Furthermore, infants who are exclusively breastfed see the most benefits. There are also benefits to the mother, including weight loss and a lower risk of cancer. In 2010, the Department of Health and Human Services launched the Healthy People 2020 initiative to achieve the overall goal of promoting good health for all. As part of the initiative, maternal, infant, and child health objectives were created. One of the main goals was to increase the proportion of infants who were breastfed. This slide shows the current versus target rates of breastfeeding in the U.S. for babies born in 2016. As you can see, the rate of infants ever breastfed was above the target at 83.8%. However, at 6 months, that rate drops to 57.3%, falling below the target rate of 60.6%. Furthermore, the rate of infants exclusively breastfed through 6 months of life dropped to 25.4%. The purpose of the study is to better understand the behaviors and attitudes that women in an urban underserved community, that is Flint, Michigan, have about breastfeeding. We aim to identify barriers to breastfeeding with the goal of designing practical initiatives to support women who wish to breastfeed, and we hope to make breastfeeding a public health issue that gets more attention, especially in underserved communities. This is a multi-site cross-sectional questionnaire study. The survey that we developed collects demographic data and asks participants to indicate how much they agree or disagree with general statements about breastfeeding on a Likert scale. Recruitment and enrollment sites include the Labor and Delivery Unit at McLaren Flint Hospital and the McLaren Flint Family Medicine Clinic. Descriptive statistics were performed to summarize characteristics of the study participants as well as their attitudes and behaviors around breastfeeding. The study received approval from the McLaren Healthcare Institutional Review Board. Women 18 years and older who have given birth within 24 months of enrollment are eligible for the study. Women with cognitive impairment and not able to give consent, as well as women with infants who spent any time in the NICU, were excluded. We recruited women in the Labor and Delivery Unit of McLaren Flint Hospital after they gave birth, and also women who brought their child into the McLaren Flint Family Medicine Clinic for a well child visit. The target enrollment is 200 women over 2 years. To date, 66 women have been enrolled in the study, and the response rate has been 100%. A majority of women were found to be white and single. 15% have a college degree or higher. 65% were employed. 67% had an annual income of less than $50,000. 70% were currently breastfeeding. And among the breastfeeding mothers, 72% were exclusively breastfeeding, and 100% of those had a child younger than 6 months old. None of the mothers with infants 3 months or older were currently breastfeeding. 30% of women in the study reported that they were not currently breastfeeding. The most common reasons found for not breastfeeding included not making enough breast milk, not having enough time due to work, and the baby not latching onto the breast. 42% of study participants preferred that a lactation specialist provide breastfeeding information, while 15% preferred that their physician provide this type of information. Only 6% reported that their doctor ever told them to breastfeed. 81% acknowledged that they knew breastfeeding was good for their baby, and 59% preferred getting breastfeeding information early on in their pregnancy. This chart depicts the beliefs that women in the study had about breastfeeding. As you may recall, the survey contained general statements about breastfeeding and asked participants how much they agreed or disagreed with those statements on a Likert scale. In summary, most women believe that breastfeeding benefits the baby. Most women also believe that breastfeeding results in greater postpartum weight loss. However, Women had mixed feelings about exclusive breastfeeding for the first 6 months of the baby's life. In conclusion, the rate of women in Flint who reported having ever breastfed was below the national rate. The rate of exclusive breastfeeding in the study was found to be high in the first month of the child's life, but none of the women in our study with children aged 3 months and older were breastfeeding. Major barriers to breastfeeding included work demands, not producing enough breast milk, and baby not latching. Women were less likely to get breastfeeding information from their physician, suggesting a missed opportunity for primary care physicians to provide this type of patient education. Also, women preferred getting breastfeeding information early on in their pregnancy, suggesting an opportunity for physicians to educate their patients about breastfeeding when they come in for their routine OB care. We will continue to enroll and collect data to better understand how to help women in Flint breastfeed more as to optimize health benefits for their babies.